Has this ever happened to you? Pain from an inflamed prostate? Well, you might have prostatitis. Now you're probably wondering to yourself, what is prostatitis? So what exactly causes prostatitis? Well, it can be caused by a number of different factors. For example, acute bacterial prostatitis is caused oftentimes by the same infections that cause UTIs. On the other hand, chronic bacterial prostatitis is caused by reoccurring UTIs. Then there's non-bacterial prostatitis, which is often linked to nerve damage, inflammation, immune issues, and injury. Take it away, Kevin.
Thank you, Alejandro. Now let's talk about its effects. Prostatitis can bring about discomfort and pain in the pelvic region, the genitals, and even the lower back. Alongside these, you might experience urinary symptoms and even sexual dysfunction. Now, I'll meet you guys back, but in the bathroom. Pause. Oh, hi. Oh, come in. Take yourself at home. So, as we were saying in the previous scenes, him, thank you, me, of course, we were playing this prostatitis. But that's just words, Who understand words? Y'all know what we're talking about. So, I thought I might as well show you pictures, actually understand what's going on. To do that, we're gonna look inside his pants. Now, look here. This is the male reproductive system. You got the bladder, the seminal vesicle, vas deferens, penis, of course, love that, urethra. But what we're going to focus on here is the prostate. Now, prostatitis, it's not normal. The normal one looks small, healthy. But see, the big one, it's all wrinkly. It's all big. It's like a balloon. So clearly there's something going on in here. This normally stems from the bacterial infections, or as we said, past UTIs, things like that. Now, we want to get into symptoms of bacterial prostatitis, a CCPS. So, frequent urination. Now, look over here to the toilet. So it's like you do this, and then 10 minutes later you do this again, like a pregnant lady. That's just too much. Or chills and fevers. Cold, you a little bit cold, burn, all that. Painful urination. It's like the toilet. It's like you do this, like it just hurt. It's just like, that's bad. Pain in your pelvis, lower region. We already did that. Stab. Pain during intercourse or ejaculation. Shorty ain't gonna mess with that. Gotta get that cleared up. It's supposed to be a joyful act. You don't want to have pain. And of course, blood and urination, which would actually look like, get the shot? Blood when you pee. No, that's just not right. Food coloring, by the way. Can't have no one thinking that we got anything. We're clean. That is what prostatitis looks like in the male organs, and these are also some symptoms of it. Now, take it away to the next scene.
Guess how common is prostatitis in men? Well, it can affect men of all ages, but it tends to be more prevalent in men under 50. Worldwide, chronic prostatitis affects around 2 to 10% of men.
Hey, real quick, we're gonna give away the spotlight to Alyssa and Jacob.
How do doctors diagnose prostatitis? Well, it typically involves a physical examination, urine tests, and possibly a prostate-specific antigen blood test. In some cases, a transrectal ultrasound or even a prostate biopsy might be needed.
Moving on to treatment options, antibiotics are often prescribed for bacterial prostatitis. Pain relievers and anti-inflammatory meds can also help manage discomfort. Plus, alpha blockers might be recommended to relax the muscle around the prostate.
Let's talk about prevention. Practicing safe sex, maintaining good hygiene, and properly treating UTIs can help reduce your risk of prostatitis.
Okay.
Brief overview of prostatitis.
Remember, if you're experiencing any symptoms or concerns,
Don't hesitate to reach out to your healthcare provider for guidance and support. Hopefully, with the knowledge we've just given you, you can defeat your prostatitis like a hit and run.